Have you ever wondered how drugs are administered and how their routes are classified? Well, ponder no more, because we're going to unravel this mystery. Drug administration is a fundamental concept in the world of medicine, and it's all about how medication is delivered into our bodies. The method or path used to deliver this medication is what we refer to as the route of administration. Why is this so important, you might ask? Well, the route of administration can significantly influence how quickly and effectively the drug works. It's not just about popping a pill or getting a shot. It's a well-thought-out process that considers several factors, including the drug's nature, the desired effect, and the patient's condition. This is just the tip of the iceberg, though. In the upcoming segments, we'll delve deeper into the classification of drug administration routes, the pros and cons of each route, and the factors that influence the choice of route. Stay with us as we delve into the fascinating world of drug administration routes. Opening. The routes of drug administration are classified into several categories. Now, let's delve into the fascinating world of drug administration. Our bodies are intricate systems, and the way we introduce medications into them can greatly impact their effectiveness. First up, we have the oral route. This is the most common and convenient way of administering drugs. We simply swallow the medication, and our digestive system does the rest. From painkillers to antibiotics, many drugs are designed to be taken orally. Moving on, we have the topical route. This involves applying the drug directly onto the skin or mucous membranes. Think creams, lotions, or patches. These are typically used for localized treatment, such as easing skin conditions or providing pain relief. Next in line is the inhalational route. This method allows drugs to be delivered directly into the respiratory system. Inhalers and nebulizers are prime examples of this route, often used in the treatment of respiratory diseases like asthma or chronic obstructive pulmonary disease. Lastly, we have the injection routes. These include intravenous, intramuscular, and subcutaneous injections. These methods are generally used when a rapid response is needed, or when the drug cannot be taken orally. Intravenous injections, for instance, deliver the drug directly into the bloodstream, providing an immediate effect. Now, it's important to note that the choice of route is not arbitrary. It depends on various factors, including the nature of the drug, the desired effect, and the patient's condition. For example, if a drug is not absorbed well in the stomach, it might be administered via injection. Similarly, if a drug needs to act quickly, it might be delivered intravenously. Each of these routes has its own unique advantages and disadvantages, which we will explore next. So, let's dive deeper into this fascinating journey of understanding how drugs journey within our bodies. After all, knowledge is power, and understanding these routes can help us make informed decisions about our health. Closing. Each of these routes has its own unique advantages and disadvantages, which we will explore next. Now, let's examine the merits and demerits of each route of drug administration. First up, we have oral administration, the most common route. This method is often preferred due to its convenience and comfort. Just think about how easy it is to pop a pill. However, the downside is that some drugs can't survive the journey through the digestive system. They might be broken down by stomach acid or enzymes before they can be absorbed. Next, we have the intravenous route, often employed in hospitals. The biggest advantage here is speed. Drugs administered intravenously take effect almost instantly as they're directly introduced into the bloodstream. But the flip side is the risk of infection and potential damage to the vein if the procedure isn't done correctly. Subcutaneous and intramuscular injections are other common routes. These methods allow for slow and steady absorption of the drug, which can be beneficial for certain medications. However, these methods can be painful and may cause local tissue irritation or damage. Inhalation is another route of administration, commonly used for respiratory conditions like asthma. The drug is quickly absorbed by the lungs' large surface area, providing rapid relief. The downside, though, is that precise dosage can be difficult to achieve, and some patients may struggle with the inhalation technique. Topical application is used when the desired effect is local, such as in the treatment of skin conditions. It's non-invasive and generally safe, but the absorption rate can be slow, and the drug may not penetrate the skin deeply enough to reach the targeted area. There's also the rectal and vaginal routes. These methods are used when oral administration isn't possible, or when a local effect is desired. They offer a high absorption rate, but they can be uncomfortable and are not suitable for all drugs or conditions. Lastly, we have the transdermal route, where drugs are delivered through patches applied to the skin. This method allows for controlled, steady release of the drug, which is great for maintaining consistent drug levels in the body. However, only certain types of drugs can be administered this way, and skin irritation is a common side effect. Intranasal and ocular routes are also used for localized treatment, such as in allergies or eye conditions. These methods offer quick and targeted delivery, but the amount of drug that can be administered is limited, and some patients may find them uncomfortable. Each route comes with its own set of considerations. Factors such as the drug's properties, the desired effect, the patient's condition, and even their personal preference can all influence the chosen route of administration. As you can see, the route of administration can significantly impact the effectiveness and safety of a drug. But how do medical professionals decide which route to use, you might ask? Well, the choice of route for drug administration is not random. It is governed by several key factors, which we will now delve into. Firstly, the patient's condition plays a pivotal role. For instance, an unconscious patient might require intravenous administration, while a patient with a local skin infection could benefit from a topical application. Similarly, patients with difficulty swallowing might be better off with a sublingual or transdermal route. The drug's physical and chemical properties also heavily influence the choice of route. Certain drugs are destroyed by stomach acid and therefore need to bypass the digestive system. Others, due to their large molecular size, cannot be absorbed through the skin or mucous membranes, necessitating an injectable route. The desired speed of action is another significant determinant. Intravenous administration provides the fastest onset of action, making it the preferred route for emergencies. On the other hand, oral administration, which offers a slower and more controlled release, is typically favored for maintenance therapy. Additionally, the potential for side effects and patient comfort and preference cannot be overlooked. For example, while intravenous administration may provide rapid effects, it also carries a higher risk of adverse reactions. Moreover, it may not be the most comfortable or preferred option for the patient. Lastly, practical considerations such as cost, availability, and ease of administration also come into play. Certain routes require professional healthcare personnel for administration, increasing the cost and potentially limiting accessibility in certain settings. In conclusion, the choice of drug administration route is a complex decision that requires careful consideration of multiple factors. It's a balance between patient condition, drug properties, speed of action, potential side effects, patient comfort and preference, as well as practical considerations. Choosing the right route of administration is a critical step in ensuring effective and safe drug therapy. So the next time you pop a pill or get an injection, remember, a lot of thought has gone into that decision. So we've covered a lot of ground today. We've dived into the fascinating world of drug administration, exploring the various routes that drugs can take to reach their target in the body. We started with an overview of drug administration, laying the groundwork for our exploration of the different methods employed in the medical field. From there, we delved into the classification of drug administration routes. We learned that these routes can be broadly divided into two categories: enteral and parenteral. The enteral route includes oral, sublingual, and rectal administration, while the parenteral route covers intravenous, intramuscular, subcutaneous, and topical administration. Each route, we discovered, has its own merits and demerits. For instance, oral administration is the most convenient and often the most preferred by patients, but it may not be suitable for drugs that are poorly absorbed in the digestive tract or that may be destroyed by stomach acid. On the other hand, intravenous administration provides immediate effect and allows for precise control of dosage, but it also carries a higher risk of infection and requires professional medical personnel to administer. We also discussed the factors governing the choice of route. These include the type and severity of the disease, the drug's properties and characteristics, the patient's condition and preferences, and the desired speed and duration of the drug's effect. In conclusion, the route of drug administration plays a crucial role in the effectiveness of medication. It's a complex field that requires careful consideration of many factors to ensure optimal therapeutic outcomes. Our journey today has been informative and enlightening. But remember, this is just the tip of the iceberg. There's so much more to discover and learn in the world of drug administration. Thank you for joining us on this journey through the world of drug administration routes. Don't forget to subscribe for more because you won't find me later.